health nurse, Sheila Early, is joining the likes of Raffi and Nardwar the Human Serviette as a recipient of the Order of Canada. Sheila is being recognized as a leader in her field of forensic nursing. Now, in the 1990s, Sheila co-founded BC's first sexual assault nurse examiner program. It's now called the Forensic Nursing Service at Surrey Memorial Hospital. And she brought in much needed training for nurses on how to treat patients who have experienced trauma and violence with dignity and with compassion. Well, Sheila Early joins us this morning. Good morning to you, Sheila.
Good morning, Stephen.
Thank you so much for being with us. Congratulations on being recognized with the Order of Canada. Tell me about the phone call.
Oh my, I'm still processing. I On my landline, I got a call that went to voicemail because I was doing something else, and I thought, oh, I'll get it later. And almost instantly, my cell phone rang, and it was quite odd. One rang and then the other. And so I looked at it and it said Governor General of Canada on it. And I thought, right. Anyway, I decided to check it out to see if it was legitimate. And I called the number back and I was connected to Emily Sauvé from the Governor General's office. And she informed me that I had been appointed to the Order of Canada as a member. And I was stunned. I was shocked. I cannot even put into words the surprise.
Did you immediately?
I even asked her for permission to sit down.
Right, I suppose, yes.
And she told me about the Order of Canada nomination, etc. And very thankfully, she repeated it completely and said, "I will follow up with an email." And of course, this was a couple of months before the announcement, so I was aware, but I also had to sign a confidentiality agreement, so I could only tell my immediate family and very, very, one or two very trusted friends. So I told my two daughters, and did not say another word until December 31st.
That's incredible. And so did you have any idea, did they tell you specifically why you were being recognized in that phone call?
Yes, they did. It's the same material that it came out in the Governor General's release on the 31st, basically for working in the field of healthcare with forensic nursing and bringing education to Canada, because I created the first certificate in forensic health sciences in Canada, and that was at BCIT.
Right.
And, it was serendipitous, Stephen. One of my students spoke to Dr. Dean Hildebrand at BCIT, and she said, "You should meet my boss." And so I went over, and lo and behold, they gave me this wonderful privilege of creating post-secondary education for forensic nursing, which was 2006, so it's 20 years old.
Right. But this all grew out of your experience as an ER nurse, is that right?
That's correct, Stephen. I started working in emergency in 1970, a year after I graduated with my Bachelor of Science from the University of Saskatchewan. And I worked in two large trauma centers, both in Saskatchewan. And then my husband and I moved here to British Columbia. And we had moved 3 times for my husband's work, and this time the move was for me. And Surrey Memorial Hospital saw something in me, and they decided to hire me, so we moved. And after almost 3 years of working in emergency, first as a assistant head nurse, and then as the educator, which was my primary goal from the day I graduated. And so it was my dream job. And then late 92, we got unusually, because we had very few women, no men, that ever presented to Surrey Emergency saying that they had been sexually assaulted. And this was not my patient as an emergency clinician or nurse. However, the complaint that was presented to us was the delay in care. Yeah. The individual had to wait. She presented in the middle of the night, and there's only one emergency physician on at emergency at that time. And as the educator, it's my job to keep the standards of practice in the department acceptable on all levels. Upon investigating it, I realized that the care that was being provided in 92 was the same care that I had been providing as a new emergency nurse in 1970.
Wow.
And I just felt that there was something not right about that. And of course, you go to statistics and you look and see what your patient population is. And I found that many of the individuals that had some sort of trauma or violence related around sexual assault were going to BC Women's Hospital. They were moving out of their catchment area. They were not being seen within their own hospital. And I wanted to know why and how we could do something about that. And long story short is I did research and found that there were nurses in the United States since the 1970s, three different groups in different areas of the United States that were calling themselves sexual assault nurse examiners and doing examinations that had historically been physician related.
Right.
And after looking at options, the only viable option was to create a program for Surrey.
And were there roadblocks or impediments to creating that program?
Yes, there were. However, the main thing was that the management team at Surrey at the time, and the medical director and the nurse manager and myself, it was supported. The ideas were supported because we did all our, you know, I guess we treated it as if it was a business plan.
Mm.
Put a proposal together with options, and then we tried to see which option was most viable. And after very little consultation, we realized that two of the options were not viable and that a nurse examiner one would be. And that's when we concretely started to look at how we could get funding to do education, hire staff, and implement a program that nobody really knew very much about.
Right. And so then, what is different now when a woman presents in the middle of the night, as you saw as an ER nurse, as the result of a sexual assault or the victim of a sexual assault? How are things different now?
Uh, Completely different. And this is just a reflection of how healthcare has moved forward.
Hmm.
Initially, a woman or a man or an adult
Yes.
or a teenager actually or a child, Surrey wasn't equipped to really handle acute cases of sexual violence for children. However, emergency departments are certainly capable. The problem is that there are very limited staff on the hours that where people present,
Yes.
and they don't normally present within an hour or 2 hours of what has happened to them, because they have to process it, and sometimes they're not even able to physically to get to a facility.
Yeah.
When they came, they were seen by a triage nurse, and then they were assessed as for injuries. And injuries are things that need to be treated in an emergency department. First is life threatening, and then everyone is categorized right down to the area where they fit in. So they might be minor, major. Emergency nursing and emergency medicine has 3 to 5 minutes to save someone's life, and that's always the priority.
Wow.
Many of these women and men were triaged. Uh, they're okay, but they can wait. Um, and then when a physician was available, if he wasn't treating or she was treating chest pains, seizure in children, um, bleeds of some kind from either trauma or disease, then because there has to be a space of time where you can be with that patient one on
Yes.
one. And so the delays were long, and the care was certainly medically oriented first. And then, if need be, then there was an examination that would collect evidence according to the RCMP kit, which all hospitals used. Uh, that could take anywhere from 2 to 4 to 6 hours of wait and an examination from 1 to 2 hours.
Right.
With the nurse examiner program, the priority was that individual with one on one nursing care.
Hmm.
So they were triaged as a special population, and the nurse involved, who was the sexual assault nurse examiner, would be paged immediately, and the response time had to be 45 minutes.
Wow.
So, saying that the delay was no longer than 45 minutes maximum. And often it was 20 minutes. For example, when I was on call, I was 6 minutes away from the hospital.
Wow.
They were offered choices. Do you want a medical care only to make sure you're safe, that you're okay, and treated for anything that you might have been exposed to? We're talking pregnancy, sexually transmitted infections, and of course, at the time, you have to remember HIV,
Yeah.
which still exists, obviously. Or you can have what's called evidence collected that samples that may link you to the other individual. Forensic nurses also care for perpetrators of crimes and violence.
Yes.
So we have to remember that this is not only people who have survived a life altering situation, it's also perpetrators. And keep that, whatever it was,
Hmm.
piece of clothing, a swab from their neck,
Yeah.
or any other body part, documenting all this information. Then we would hold it for 1 year. And if they decided that they wanted to process with going to law enforcement, then we would make it available only with their permission to law enforcement. Or they could do both. They could have a medical exam, they could have a forensic exam, and law enforcement would be notified either by them or we could call them for them. The
Right.
choices are always the individual, as long as they're competent and as long as they're of age of consent, obviously. So it offered things that were not available before in our area. Uh, BC Women's, of course, had a physician-based program, and that was had been available since the 80s. So it changed being healthcare directing what happened to the individual to the
Right.
individual directing what they wanted.
Hmm. She,
Um,
Sheila, I'm sorry, I don't mean to interrupt, but
okay.
we are going to have to leave it there this morning. I thank you so much
Okay.
for your time, and congratulations once again to you, not only on the award but on the innovations that you've brought to the way women are treated when they suffer a sexual assault. Thank you.
Thank you. And
Okay.
forensic nurses work everywhere. So that's the broad spectrum of the specialty.
Well, really appreciate your time this morning.
Thank
Thank
you.
you so much. You take care.
Okay. Bye
Bye
bye.
bye. That's Sheila Early, retired forensic nurse from BC and a new recipient of the Order of Canada.